A person can eat less salt, walk every morning, take their blood pressure pills exactly as prescribed, and still watch the numbers slowly climb. That is what makes this problem so easy to miss. After 60, high blood pressure is not always caused by one obvious mistake. Sometimes the trigger is sitting quietly in the medicine cabinet. It may be a pain reliever taken for stiff knees. It may be a cold medicine used for a blocked nose. It may be a prescription that was given for inflammation, mood, migraines, or another condition that seems completely separate from the heart. The person taking it may never connect that pill with the pressure inside their arteries. I am Dr. Warren Hung, a medical doctor, and this is one of those topics people need explained in plain language. Because the danger is not that every medication is bad. The danger is not knowing which ones can push blood pressure higher, especially as the body gets older. And if you value clear health explanations without confusion, take a second to subscribe. My goal is to help you understand what may be happening inside your body before small changes become bigger problems. The first thing to understand is that the body after 60 does not handle medication the same way it did at 30 or 40. The kidneys may filter more slowly. The blood vessels may be stiffer. The body may hold on to salt and water more easily. The nervous system may react more strongly to certain chemicals. That means a medication that felt harmless years ago can have a stronger effect later in life. Blood pressure is basically the force of blood pushing against the walls of the arteries. When there is more fluid in the bloodstream, pressure can rise. When blood vessels tighten, pressure can rise. When the kidneys cannot remove extra salt and water as well, pressure can rise. When a medication interferes with the way blood pressure medicine works, pressure can rise even if the person has not changed anything else. That is what confuses many people. They say, I did not change my diet. I did not gain weight. I did not stop exercising. Why are my readings higher? But they may have started a new medication, increased a dose, taken something over the counter, or added a supplement without realizing it could affect blood pressure. This is especially common because many of these products are ordinary. They are not viewed as serious. A person may take something for back pain, arthritis, allergies, congestion, sleep, mood, or inflammation, and never think to mention it during a blood pressure visit. The doctor may ask about prescription medicines, but the patient may forget the pills bought at the pharmacy, the powder ordered online, or the cold medicine taken for a few nights. That missing detail can matter. After 60, medication effects can also stack on top of each other. One medicine may cause the body to hold fluid. Another may narrow blood vessels. Another may make the kidneys work harder. A fourth may reduce the effect of a blood pressure medication. Each one alone may seem small, but together they can create a pattern the person does not recognize, until the blood pressure cuff starts showing higher numbers. This does not mean you should suddenly stop taking medicine. That can be dangerous, especially with blood pressure pills, heart medications, steroids, antidepressants, seizure medications, or anything prescribed for a serious condition. A sudden stop can sometimes cause withdrawal effects, rebound symptoms, or even a medical emergency. The safer step is to bring the full medication list to a doctor or pharmacist and ask directly, could any of these raise my blood pressure? And when I say full list, I mean everything. Prescription medications, over-the-counter pills, cold and flu products, pain relievers, herbal products, weight loss products, energy boosters, eye drops, nasal sprays, creams used often over large areas. Many people only list the pills they take every day, but the occasional medicines can be the ones that explain a sudden spike. There is another reason this problem is easy to miss. High blood pressure often does not feel dramatic. Some people expect pounding headaches, chest pressure, dizziness, or a racing heart. But blood pressure can be high without giving clear warning signs. A person may feel normal while the arteries, heart, brain, and kidneys are under more strain than usual. That is why tracking matters. If you start a new medication and your readings begin rising over the following days or weeks, that pattern is worth discussing. If your pressure suddenly becomes harder to control after adding a new pain reliever, cold medicine, steroid, or stimulant-type product, that is not something to ignore. The goal is not fear. The goal is awareness. The medicine cabinet can tell a story the blood pressure cuff cannot explain by itself. And one of the most common places that story begins is with the pills people take for pain, stiffness, headaches, and seasonal congestion. One of the biggest mistakes people make with blood pressure is assuming that only prescription medicines are powerful enough to cause problems. But some of the most common pressure-raising drugs are sitting on pharmacy shelves, sold without a prescription, used by millions of people for pain, stiffness, headaches, fever, sinus pressure, and colds. The first group is NSAID pain relievers. That stands for non-steroidal anti-inflammatory drugs. Common examples include ibuprofen and naproxen. Many people know them by brand names, But the important thing is the ingredient on the label. These medicines can be useful for pain and inflammation, and many people take them because arthritis, back pain, knee pain, and joint stiffness become more common with age. The problem is that after 60, especially in someone with high blood pressure, kidney disease, diabetes, heart failure, or a history of heart problems, these drugs can make pressure harder to control. The reason is not mysterious. NSAIDs can affect blood flow inside the kidneys. The kidneys are not just filters. They help control how much salt and water stays in the body. When kidney blood flow changes, the body may hold on to more sodium and fluid. More sodium pulls more water into the bloodstream. More fluid in the bloodstream means more volume pressing through the arteries. And when the arteries are already stiffer with age, that extra volume can push readings upward. That is why someone may take ibuprofen for a sore shoulder for a few days and then notice their blood pressure is higher than normal. They may think the pain caused it. Pain can raise pressure, yes, but the medication used for the pain may also be playing a role. NSAIDs can also interfere with certain blood pressure medicines. Some blood pressure pills work partly by helping the kidneys relax pressure systems, remove extra fluid, or reduce strain on blood vessels. NSAIDs can work against some of those effects in certain people. So the person may still be taking their blood pressure pill faithfully, but the pressure is not responding the way it used to. This is one reason pharmacists often ask about blood pressure, kidney disease, blood thinners, heart disease, or stomach bleeding before recommending pain medicine. Those questions are not just formalities. They help catch risk before a common product creates a serious problem. This does not mean every person can never take an NSAID. It means the decision should be more careful after 60, especially if the person already has hypertension or kidney concerns. Some people may need a different pain strategy. Some may need to use the lowest effective dose for the shortest reasonable time. Some may be told to avoid them. That is a conversation to have with a healthcare professional who knows the full medical picture. The second group is decongestants. These are often found in cold, flu, allergy, and sinus products. Common ingredients include pseudoephedrine and phenylephrine. People take them because they want to breathe through their nose again. And when congestion is miserable, a strong decongestant can feel like relief. But decongestants work by narrowing blood vessels in the nose. That shrinking effect helps reduce swelling in nasal passages. The issue is that the body does not always limit the effect to the nose. In some people, especially those with blood pressure problems, these medicines can tighten blood vessels more broadly, or stimulate the body in a way that raises pressure. Think of it like squeezing a garden hose. If the same amount of fluid is pushed through a narrower space, pressure rises. Blood vessels are not garden hoses, but the basic idea helps explain why a medicine meant for sinus pressure can affect artery pressure. This matters because decongestants are often hidden inside combination products. A box may say cold and flu, sinus relief, multi-symptom, or daytime congestion, but the ingredient list may include a stimulant like decongestant. A person may not realize they are taking it because they are focused on the brand name, not the active ingredient. That is where many seniors get caught. They do not think of cold medicine as a blood pressure issue. They may take it for 3 or 4 days during a winter illness, check their blood pressure, and see numbers that look unusual. Then they wonder whether their hypertension suddenly got worse. Sometimes it did not suddenly get worse. Sometimes the body was reacting to the medicine, the illness, poor sleep, dehydration, pain, and stress all at the same time. The practical step is simple but powerful. Read the active ingredients, not just the front of the package. If you have high blood pressure, ask the pharmacist before taking cold or sinus medicine. Look for warnings that mention hypertension, heart disease, thyroid disease, prostate problems, glaucoma, or interactions with other medications. Also be careful with doubling up. Someone may take a separate pain reliever, then a cold medicine that already contains a pain reliever. Or they may take one sinus product in the morning and another at night, without realizing both contain similar active ingredients. That can increase side effects and make it harder to know what is causing the blood pressure change. If you have ever noticed your blood pressure jump during a cold, pain flare, or sinus infection, think back to what you took during those days. Was there ibuprofen, naproxen, a sinus pill, a multi-symptom cold product? That pattern is worth writing down and discussing. Pain and congestion feel like short-term problems, but the medicines used for them can put real pressure on an older cardiovascular system. And the same lesson applies to prescriptions too, because some drugs given for inflammation, mood, energy, or focus can change blood pressure in ways people never expect. Some medications raise blood pressure in a way that feels obvious. A person takes a strong cold medicine, feels their heart beating faster, checks the cuff, and sees the number climb. But prescription medications can be different. They may not feel stimulating. They may not cause a dramatic reaction. They may be given for a real medical reason, by a careful doctor and still make blood pressure harder to control in certain people. That is the part many people misunderstand. A medication can be appropriate and still have a side effect. Those two things can both be true. One of the most common examples is corticosteroids, such as prednisone. These are used for many conditions involving inflammation: severe allergies, asthma or COPD flare-ups, autoimmune conditions, joint inflammation, skin problems, and other medical issues. They can be very helpful when inflammation needs to be brought down quickly. But corticosteroids can also affect blood pressure. They can make the body hold on to more salt and water. They can influence hormones that help regulate fluid balance. They may also raise blood sugar in some people, which can add more stress to the blood vessels over time. For a younger person taking a short course, the effect may be small or temporary. But after 60, especially in someone with high blood pressure, diabetes, kidney disease, heart failure, or a history of swelling in the legs, the effect can matter more. A person may take prednisone for a breathing flare or severe pain, and then notice their ankles feel puffier, their weight jumps a few pounds, or their blood pressure readings rise. That does not mean the steroid was never needed. It means the body may need closer monitoring while using it. Dose and duration matter. A short course is different from taking steroids repeatedly or using them long-term. Higher doses usually carry more risk, and some people are simply more sensitive than others. This is why it is reasonable to ask, while I am on this medication, should I check my blood pressure more often? The second prescription group is certain antidepressants, especially a class called SNRIs. These include medicines that affect serotonin and norepinephrine. Serotonin is involved in mood, sleep, and many body signals. Norepinephrine is also involved in alertness and the body's stress response. That does not mean these medications are bad. For many people, they can be helpful for depression, anxiety, nerve pain, or other conditions. But because norepinephrine can influence heart rate and blood vessel tone, some people may see an increase in blood pressure, especially at higher doses or after a dose change. The key to successful management is consistent monitoring. If someone starts a new mood medication and their blood pressure rises over the next few weeks, that pattern should be mentioned. It may not be the cause, but it should be part of the discussion. Sometimes the answer is adjusting the dose. Sometimes it is changing timing. Sometimes it is choosing another option. That decision belongs with the prescribing clinician, not with guessing at home. This matters because mental health treatment is important. People should not be frightened away from care. Untreated depression, anxiety, poor sleep, and chronic stress can also affect the body. The goal is not to reject treatment. The goal is to treat the whole person, including the blood pressure risk. The third prescription group is stimulants. These may be used for attention problems, certain sleep-related conditions, fatigue in selected cases, or appetite-related reasons. Some people also take stimulant-like products outside of traditional prescriptions, but the prescription category alone deserves respect. Stimulants can increase alertness by activating parts of the nervous system. In plain language, they can tell the body to wake up, focus, and push harder. That same signal can increase heart rate and tighten blood vessels in some people. When blood vessels tighten, the heart has to push against more resistance. When the heart beats faster or harder, pressure may rise. For a healthy younger person, that may be tolerated. For someone over 60 with stiff arteries, heart rhythm problems, coronary artery disease, or long-standing hypertension, it may be more complicated. This is where a blood pressure log becomes very useful. Do not rely only on how you feel. A person may feel more focused or energized while the cuff is showing higher readings. The body does not always send a clear warning. A good log includes the time of day, the blood pressure reading, pulse, medication timing, dose changes, pain level, sleep quality, caffeine intake, and any new symptoms. That may sound like a lot, but even a simple 1-week record can help a doctor see patterns that would otherwise be missed. The important question is not, is this medication dangerous for everyone? That is too simple. A better question is this medication safe for my blood pressure, my heart, my kidneys, and my age? That one question changes the conversation. Prescription medications deserve respect because they are powerful enough to help. But anything powerful enough to help can also create strain in the wrong setting. And once hormones, immune signals, blood vessels, and kidney function get involved, some of the most surprising blood pressure triggers are the ones people never think to mention. Some blood pressure triggers are easy to imagine. A stimulant can raise the heart rate. A decongestant can tighten blood vessels. A pain reliever can make the body hold fluid. But other medications work in quieter ways. They may affect hormones, kidney blood flow, immune signaling, or the way blood vessels respond to stress. Understanding these complex interactions is the key to maintaining your health as you age. Always talk to your healthcare provider. Because of that, many people never connect them to rising blood pressure. One group is hormone therapy. This can include different forms of estrogen, testosterone, thyroid-related medication, and other hormone-based treatments depending on the person's condition. Hormones are not just about one body system. They can affect fluid balance, vessel tone, blood clotting, metabolism, heart rhythm, and how sensitive the body is to other medications. That is why hormone treatment after 60 should never be treated casually. For some people, it may be appropriate under medical supervision. For others, especially those with uncontrolled high blood pressure, heart disease, stroke history, blood clot history, or certain cancers, the risks may be very different. The blood pressure effect depends on the type of hormone, the dose, the route, and the person taking it. A pill may not behave the same as a patch, cream, injection, or implant. A low dose may not carry the same risk as a higher dose. And a person with healthy arteries may respond differently than someone with decades of hypertension. The practical point is simple. If your blood pressure changes after starting or changing hormone treatment, do not ignore the timing. Write it down. Ask whether the treatment could be affecting fluid retention, vessel response, or cardiovascular risk. The goal is not to assume the hormone is the cause. The goal is to make sure it is not being missed. Another overlooked group is certain migraine medications, especially triptans. These drugs can help stop migraine attacks in some people by acting on serotonin receptors and narrowing certain blood vessels involved in migraine pain. For the right patient, they can be useful. But that blood vessel effect is exactly why they require caution in people with uncontrolled high blood pressure, coronary artery disease, stroke history, or significant vascular risk. A person may think, this is just my migraine medicine. It has nothing to do with my blood pressure. But the blood vessels in the body are connected to the same overall circulation system. If a medicine can narrow vessels to help migraine pain, a doctor needs to know whether that narrowing is safe for that person's heart and arteries. This is especially important after 60 because the risk picture often changes. Someone may have used a medication for years, but now they have higher blood pressure, plaque in the arteries, kidney disease, diabetes, or heart rhythm concerns. The old medication list may need a fresh look. Then there are immunosuppressant medications, such as cyclosporin and tacrolimus. These are not everyday drugs for everyone, but they matter because people who take them often have serious medical histories, such as organ transplant care or autoimmune disease treatment. These medicines can affect kidney function and blood vessel control. When the kidneys are under strain, blood pressure can become harder to manage. This connection is important because many people think of the kidneys only as organs that make urine. But the kidneys are deeply involved in blood pressure regulation. They help decide how much fluid stays in the body. They influence hormones that tell blood vessels to tighten or relax. Furthermore, they affect the body's salt balance. When a medication stresses the kidneys, blood pressure may rise even before a person feels anything obvious. That is why people taking immune-related medications often need regular blood tests and pressure checks. Those checks are not just routine paperwork. They are part of catching early strain before it becomes a bigger problem. The ninth category is one that surprises many people. Herbal products, supplement-like products, and natural remedies that act like medications. The word natural does not mean harmless. Some natural substances can affect blood pressure strongly. Licorice is a good example. Real licorice root, not just candy flavoring, can lower potassium and cause the body to retain sodium and water. Low potassium and extra fluid can raise blood pressure and sometimes create heart rhythm concerns. A person may drink licorice tea, take a digestive supplement, or use an herbal blend without realizing it has a real chemical effect on the body. Stimulant-style weight loss products, energy boosters, and certain performance products can also raise blood pressure. Some contain caffeine, bitter orange, yohimbine, or other stimulant-like ingredients. Others may have unclear labels or combinations that make the total effect hard to predict. This is where older adults need to be careful. A supplement can interact with prescription medication. It can affect the liver or kidneys. It can raise pulse or pressure. It can make dizziness, sleep problems, palpitations, or headaches more likely. And because supplements are often not discussed during doctor visits, the connection can be missed. Bring the actual bottles to appointments when possible. Do not rely on memory. A name, dose, ingredient list, and frequency can change the medical advice. A pharmacist can often spot a blood pressure concern quickly if they can see the full list. By now, the pattern should be clear. The issue is not one single pill. It is the way blood vessels, kidneys, hormones, nerves, and fluid balance respond as the body gets older. Once you see that pattern, the safest step is not panic. It is knowing exactly how to check your own risk before the numbers get out of control. The safest response to this information is not fear. It is not throwing away medications. It is not suddenly stopping a prescription because the blood pressure cuff showed a higher number. The safest response is to become more organized, more observant, and more willing to ask direct questions. That matters because stopping certain medicines suddenly can be dangerous. Some blood pressure medicines can cause rebound pressure if stopped too quickly. Some heart medicines can trigger rhythm problems or chest pain if stopped without guidance. Some antidepressants can cause withdrawal symptoms. Steroids may need to be tapered depending on the dose and duration. Medicines for seizures, immune disease, hormones, and other serious conditions should never be changed casually. So the first rule is simple. Do not stop or adjust a medication on your own, unless your doctor has already told you exactly how to do it. If you suspect a medication is raising your blood pressure, treat that as a reason to call your doctor or pharmacist, not as a reason to experiment alone. The second rule is to track your blood pressure correctly. Many people get misleading readings because they measure while rushed, anxious, talking, or moving around, sitting with feet dangling, or checking right after coffee, pain, stress, or exercise. A blood pressure reading is only useful if it is taken in a consistent way. Sit quietly for about 5 minutes. Keep both feet flat on the floor. Make sure to support your back. Rest your arm at heart level. Use the right cuff size. Do not talk during the reading. If the first number seems unusually high, wait a minute or two and check again. Write down the readings instead of trying to remember them. The third rule is to connect readings to timing. This is where many people find the clue. Do the numbers rise after starting a new pain reliever? Was it after a steroid prescription? Was it after starting a cold medicine? Was it after a medication dose increase? Was it after adding a new supplement? After several bad nights of sleep? After a week of worse arthritis pain? A single high reading may not tell the whole story. A pattern tells much more. Create a simple medication list. Include the name, dose, how often you take it, and why you take it. Include prescription medications, over-the-counter drugs, vitamins, herbal products, teas, powders, drops, sprays, creams, patches, and anything taken only once in a while. Occasional products can still matter, especially if the blood pressure spike also happens occasionally. Then bring that list to a doctor or pharmacist and ask clear questions. Ask, could any of these raise my blood pressure? Ask, could any of these interfere with my blood pressure medication? Ask, is there a safer pain relief option for someone with hypertension? Ask, should I avoid decongestants? Ask, should I check my blood pressure more often while taking the steroid, hormone, migraine medicine, antidepressant, stimulant, or immune medication? Ask, are my kidneys healthy enough for this medication? Those questions are practical. They do not accuse the medicine of being wrong. They help your healthcare team see the full picture. It is also important to know when blood pressure needs urgent attention. If a reading is extremely high and you also have chest pain, shortness of breath, weakness on one side, trouble speaking, confusion, fainting, severe headache, vision changes, or symptoms that feel sudden and serious, do not sit at home trying to solve it with internet advice. It is critical that you seek urgent medical care immediately. For less dramatic but repeated high readings, call your healthcare provider and explain the pattern. Mention recent medication changes. Mention cold medicines, pain relievers, steroids, supplements, and anything new. That information can change the decision. Let's bring the 9 categories back into one clear picture. NSAID pain relievers like ibuprofen and naproxen can affect kidney blood flow and fluid retention. Decongestants can tighten blood vessels. Corticosteroids can make the body hold salt and water. Certain antidepressants, especially SNRIs, may raise pressure in some people. Stimulants can increase heart rate and vessel tone. Hormone therapies can affect fluid balance and cardiovascular risk, depending on the person. Some migraine medicines can narrow blood vessels. Immunosuppressants can affect kidney function and pressure control. Herbal or supplement-like products, including real licorice, and stimulant-style weight loss products, can act more powerfully than people expect. The main lesson is not that every one of these must be avoided by every person. The main lesson is that after 60, the body gives medications a different setting to work in. Older arteries, sensitive kidneys, existing hypertension, diabetes, heart disease, and multiple prescriptions can turn a small side effect into a real blood pressure problem. That is why awareness matters so much. You do not need to be afraid of your medication list. You need to understand it. You need to know which products deserve caution, which symptoms deserve attention, and which questions can protect you from avoidable harm. If this helped you see your medicine cabinet differently, subscribe for more clear health explanations from Dr. Warren Hung. And if you take several medications, consider sharing this with someone in your family, because sometimes the most important blood pressure clue is not found in the salt shaker. It is found on the label of a bottle people stopped questioning years ago.